Hi friends, welcome to Lovenics. We study many books in college. In that book, did you see these kind of words in that book? Medial, lateral, anterior, superior, posterior. What is the words? What is the meaning of this word? These are the anatomical terms. In this video, we are going to see the meaning of the anatomical terms. Anatomical terms used to describe the area of body parts, and it is also used to minimize the confusion while studying the direction. First, anatomical plane. Median plane. Median plane is the imaginary vertical line. It passes to the center of the body. This is the center of the body. This one is the median plane. Divides the body into right and left. Coronal plane. It is the imaginary plane that right angle to the median plane. It is divides the body into anterior and posterior, which means front and back. Horizontal plane. It is the imaginary plane that right angle to the coronal plane and median plane. It divides the body into superior and inferior. Terms of anatomical position. Supine and prone. When the body is lying face up in anatomical position. This is the supine, and prone means when the body is lying face down in anatomical position. This one is the prone. Terms of anatomical relationship. Superior and inferior. Superior means near to the head, inferior means near to the foot. For example, heart is superior to the diaphragm. This is the heart and this one is the diaphragm. The heart is superior to the diaphragm, and inferior means near to the foot. This is the diaphragm. The diaphragm is inferior to the heart. Next, anterior and posterior. Anterior means near to the front. Posterior means near to the back. For example, sternum. This one is the sternum. The sternum bone is anterior to the heart and the heart is posterior to the sternum. Medial. Medial means near to the medial plane. Lateral means farther from the median plane. For example, the heart is medial to the lungs and the lungs are lateral to the heart. Terms of comparison. Proximal and distal. Proximal means near to the part of origin. Distal means away from the part of origin. For example, upper limb, this joint is the origin. This is the humerus bone. Humerus bone is proximal to the radius and ulna. The radius is distal to the humerus bone. And proximal convoluted tube and distal convoluted tube in the nephron are also the example for the proximal and distal. Superficial. Superficial means near to the surface and deep means farther from the surface. Example for the superficial is skin. Skin is superficial in our body and the organs are deep in our body. External. External means towards the exterior. Internal means towards the interior. Ear pinna is external in hearing pathway and cochlea is located interior, which means inside our body. Central. Central means near to the center. Peripheral means away from the center. Example for the central is central nervous system, that is brain and spinal cord. These are center in our body. And peripheral nervous system. These peripheral nerves are away from the center, right? So these are the peripheral nerves. Peripheral nervous system. Parietal. Parietal means external wall of body cavity. Visceral means pertained to covering the organ. Example for parietal is parietal layer in heart and lung, and visceral example is visceral layer in heart and lung. The visceral layer is near to the organ, so it is called visceral layer. Evagination. Evagination means outward bulging of the body cavity. Invagination means inward bulging of the body cavity. Example for the invagination is phagocytosis, The microorganism is engulfed by phagocytosis. This is invagination and the waste material from the lysosome. The waste products are removed from the cell by evagination. Terms related to movement at the joint. Flexion. Flexion is the decreasing angle between the bones of the body. This is one bone and this one is another. Decreasing angle between two bones. This is flexion and making the increased angle between the bones. This is one bone, this one is another, and making the angle increase, that is extension. Abduction. Abduction means moving away from the median plane. Adduction means moving towards the median plane. This one is correct spelling for the adduction. This movement is abduction and this one is the adduction. Circumduction. Circumduction means circular moving, that is combining with flexion, abduction, extension and adduction. This circular motion of the body. Rotation. Rotation means moving around the long axis. This one is the rotation of arm. Medial rotation means inward rotation. This one is the inward rotation of leg. Lateral rotation means outward rotation. This one is the lateral rotation. Eversion is the raising the lateral border of the foot. This one is the lateral border and move the foot to outside. Inversion means raising the medial border of the sole of the foot. This one is the inversion. Pronation is the rotation of forearm so that the palm is towards backside. This one is the pronation. And supination means rotation of the forearm so that the palm is towards forward. This is the supination and this one is the pronation. Protrusion. Protrusion means moving anterior. Retraction means moving posterior. Terms related to blood vessels. Artery. Artery that carries oxygenated blood away from the heart. Exception for the artery is pulmonary artery and umbilical artery. These vessels carries the deoxygenated blood. An example for the artery is carotid artery. Vein. Vein that carries deoxygenated blood towards the heart. Exception for the vein is pulmonary and umbilical vein. Example is internal jugular vein. This is the internal jugular vein and this rector is the carotid artery. Arteriole. Arteriole is the smallest branch of arteries within the tissue. And venule is the minute vessels that join to form the veins. Capillary. Capillary is the microscopic vessels that connect the arteriole and venules. This is the large artery. This one is the small artery that is divided into arteriole, and this one is the large vein that is formed by small veins. That small vein is formed by venules, and this venule is formed by microscopic vessels. That venule and arteriole is connected by the capillaries. Terms related to muscles. Origin. Origin is the one end of the muscle. It is less movement during contraction. This one is the proximal attachment of the muscle. For example, deltoid muscle origin is clavicular part, acromial part and spinal part. These are the origin of the deltoid muscle. Insertion is another end of the muscle and more movement during contraction. It is distal attachment of the muscle. For example, deltoid muscle insertion is deltoid tuberosity. In here, the deltoid tuberosity is present. This one is the insertion of the deltoid muscle. Belly. Belly is the fresh and contractile part of muscle. Flesh, not a fresh. Flesh, contractile part of the muscle. Tendon. Tendon is the fibrous and non-contractile part of the muscle. This one is the tendon. In muscle, origin, belly, insertion and tendon is present. Aponeurosis is the flattened sheet of dense connective tissue that attaches to the bone. Example for the aponeurosis is abdominal aponeurosis. Overview of anatomical terms. Plane, median plane that divides the body into right and left. Coronal plane that divides the body into Anterior and posterior horizontal plane that divides the body into superior and inferior. Terms related to movement at joint are extension, flexion, abduction, adduction, circumduction, rotation, medial rotation, lateral rotation, eversion, inversion, pronation, supination, protrusion, and retraction. Terms of comparison are proximal, that is near to the origin, distal, away from the origin, superficial, that is near to the surface, deep, which means farther from the surface, external means towards the exterior, internal means towards the interior, central means near to the center, peripheral means away from the center, parietal means external wall of the cavity, visceral means covering the organ, ipsilateral means same side, consolateral means opposite side, invagination means outward bulging, invagination means inward bulging. Terms of relationship: superior means near to the head, inferior means near to the foot, anterior means near to the front, posterior means near to the back, medial means near to the medial plane, lateral means farther from the median plane. Terms of anatomical position are supine. Supine means lying face up, prone means lying face down. Terms of muscles are origin, belly, tendon, incision, and aponeurosis. Terms of vessels are artery, arteriole, capillary, venules, and veins. Question time. Coronal plane means divides the body into anterior and posterior. Anterior means front. Proximal means near to the origin. Abduction means moving away from the median plane. Vein means the vessel which carries the deoxygenated blood towards the heart. Artery exception is umbilical artery and pulmonary artery. Thanks for watching.